record and then. All right, good morning, everyone. Welcome to the last vaccine equity call of the year. I am currently in the emergency room. Next slide. So a rather crazy thing happened a few days ago. This is me and my daughter as we're waiting for our shot, but not a vaccine shot. She's been complaining of nightmares in the past few days, saying shadows are like in her room. And 2 in the morning, a few days ago, I ran up to her room because she was screaming, ta, 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 ta. I was like, there's nothing up there. It's just shadows. And as I was pointing at the shadows, which I thought were being cast by the fan, a bat flew at me. And a bat just started flying around the room. And she started screaming like there was no, like for a 4-year-old, she had a full-on horror movie scream. So I threw the blanket over her and then just proceeded to kill the bat. It was 2 in the morning. I wasn't thinking about it. I threw the bat outside and then started sharing the story. A few of you heard it on the steering committee call, and it was a funny story until somebody said, like, well, wait, did you guys get a rabies shot? We're like, it's so rare that you would get rabies. I mean, 99% of bats don't have rabies. But if you get it, you have a 99% chance of death. It is game over. The problem is what should be a routine shot is very unroutine. So as you can see here, we're in the hallway. The reason we're in the hallway in the emergency room, very few places carry a bat vaccine or the rabies vaccine, is because of COVID. Our hospitals are overrun. It took about 4.5 hours to get a shot. And we have to repeat this for every family member over the next week because a rabies shot is multi-use. So in short, I wanted to say thank you and the gratitude for everyone here because we're getting closer to this. And the rabies vaccine is actually a really good example. It is incredibly effective. There were 2 cases of rabies last year in the United States, 2, and that's been the average. I mean, it has been eradicated. We'll never get there with COVID. COVID is going to be endemic probably for the next 10 or 20 years, but we can make it manageable. And so thank you for everyone for what you're doing here so we don't have to deal with this hopefully soon. 4-hour waits. I mean, for us, it was okay, but the woman next to us behind that screen was in severe pain for falling and potentially fracturing her spine. And for the 4 hours we were there, she could not get a room because they are overrun. The lingo here is called positives. When a positive comes, they get taken to a different part. The hospitals are still overwhelmed. And as we head into winter, it's going to get worse. But we have a lot of good news to share. So just wanted to start with that story before we get to headlines. But main thing is we're all okay. We're here for an overabundance of caution. I'm waiting in the emergency room while my second daughter gets her shot, which is happening actually probably right now. Next slide. So today we're going to go into some headlines. We're going to present our first vaccinator award for an organization that's been going above and beyond. Talk about doing vaccinations in restaurants, in McDonald's. How does that work? Especially as we're going into the winter season and we can't do outdoor vaccinations or organize them in parking lots. That'll be key. And then we're going to talk about the final thing we need to unlock the funding from our funders for the second half of the funding for the coalition. Next slide. So first, Clean has been doing just an amazing job. We have been looking at the data and as everyone does their weekly reports, which you can now all see. Actually, Jamal, can you show the dashboard? We've been looking at it for outreach in terms of the second half of the funding from Twilio, which should be coming in January. We're feeling really, really good. We're way above reach. We also have enough data. You can see now a projection there on the bottom right that we're looking very good on target. And now I feel, outside of something called cataclysmic, I mean, we're feeling very, very good about receiving the second half of the funding, distributing it to the coalition I think it's mid-January is according to the agreement. And there are certain organizations, you can see those orange bars there on the left recently of Clean. And so if you can go back to the presentation, Jamal, and put full screen, I'd like to have Andrea talk about why they've been so effective.
Hey everyone, I'll go ahead and turn my camera on. Nice to meet everyone, and thank you for the recognition. I did have a question about the Vaccinator Award. Does that mean that we are being recognized as like an organization helping folks getting vaccinated, or
It was I mean, we came up with the word. It's the kind of, it's been a chaotic 24 hours. We had meant to plan for this, but I've been in the ER for
No,
the past day. So it's internal. It's part
thank
of the
you.
reason, but it's like, I think everyone should give a round of applause because you guys
Thank
have been
you.
killing it.
Yeah, thank you so much. Well, I just want to share, we have a great team of about 5 or 6 folks that go out into the field, and we uh, speak to community members. We try to focus in communities that we have been made aware of, because we do work very closely with the health department in LA County. We get updates. And we can, sense and see where there are communities that have low vaccination rates. And so our team, we go out into like areas that are very, either heavy foot traffic or areas where community members might gather, whether that be parks, shopping centers. And so our team preps kits, right? We call them the PPE kits. We've been I would say almost for a year now, prepping and distributing these kits. And inside these kits, we went ahead and, started making our own hand sanitizer bottles here at Clean, from the gallon sanitizers that have been given either by the city or the county. We go ahead and pick those up. They've been totally free for us. And we went ahead and purchased individual plastic bottles and put our own labels on them and distributed those sanitizers along with gloves, disposable face mask, N95 mask inside of those clear like plastic bags. And I wish I would have grabbed a bag to show you all an example. And we also include information not only about the vaccines, we include information about Know Your Rights, which is better known as the red card inside of it. And we also include information about their rights at the workplace in regards to COVID-19. And, the labels do have, of the sanitizers that we do make, do have a contact phone number on it as well. And so that has been great, not only to get a sense of how much needed these PPE kits are still needed in our communities, right? But also in terms of getting folks to trust someone to get them, scheduled for either a vaccine or understand a bit more about what the vaccine is and what it isn't. It hasn't all been nice, right? We do still have a lot of pushback from community members. Sometimes they get kicked out of a particular location, but they go on and move on to the next one. And so that's been a little bit about a little bit of what we do. So we get confirmations, but we also the team does come back to the office, and then they have either phone numbers or they schedule vaccines on site through their phone, to these community members. And then that particular community member will then share our phone number with other family members or neighbors, and they'll say, hey, call them, they helped me. So that's a little bit of what we've been doing.
Thank you, Andrea. And one thing too, that's, as we've seen this marked increase, and these are what we call, I can't remember if it's specifically unverified or just people saying that they did get vaccinated. And we've seen across a number of organizations, as we've been applying for more funding, of the value of incentives. And so whether it's those PPE kits, as Andrea mentioned, IMSchools did a back to school session where people got back to school kits. Those handouts do matter, and those are perfectly acceptable and actually encouraged in the budgets. We do have a very strong lead, and because of Clean's work, they were included and pledged more funding from Cal Wellness. We do have a small amount of funding that's going to go to a few partners based on their weekly reports, based on their impact, and they have to be California based. Unfortunately, for some of the members of this coalition that are not based in California, that particular funder, if we do get it, which we are in final work with them on, essentially signing a contract to get additional funding, will go to those organizations. I think we have notified every organization that would receive that funding, but it is from those weekly reports. So on behalf of Jamal, please make sure you get your weekly reports in. He is taking a lot of his time to do reminders. He can help update. If you missed something or did something incorrect, just send him the numbers. He can update. But just out of respect for Jamal and his workload, please get your weekly reports in on time. And it does make an impact on the funding that is coming in. Next, please. So again, overall impact, we are on target. We're doing well. Our projections, you can now see it. Everyone has access to the dashboard in the lower right. You can actually see coalition-wide. Does that projection work, Posey, by the way, individually, or is it only coalition-wide?
Coalition-wide right now.
Okay. So right now, one of the things we're also noticed, we did take a look at this with the steering committee on Monday, and we did notice a significant number of increase in both vaccinations on site, which we'll talk about in a second, like at a McDonald's or at a farmer's market. And then also as Clean does, when they're just getting notifications that they got vaccinated. Why is that happening? Boosters are now widely available. And then pediatrics. The 5-year-olds should be available anytime. And then 2-year-old, I think in the next month for the 5-year-old, 2-year-olds early next year is what they're projecting. So the base of the population that can get the vaccine is increasing. And across the entire organization, we're seeing an uptick in vaccinations. So great news there. Next slide, please. So next, I'm going to hand it over to Panita at Thai CDC, because at our steering committee, there were a couple of organizations and they mentioned they were doing vaccines on site in McDonald's. And we were wondering, well, how do you do that? And as we get into winter season, for those of us no longer in California, it's going to be a big thing. Well, California too gets a lot of rain. So how do you do a vaccine on site inside a McDonald's? Here's how it's done.
Okay, thanks, Bart. Good morning, everyone. Well, it's morning for us anyhow. I'm so pleased to be able to tell you all a little bit about some of the work that we've been doing with employers in the LA area. So just as a little bit of a background, Thai CDC has been working on a different project with the LA County Department of Public Health to go ahead and work directly with employers who have high volumes of COVID outbreaks or COVID complaints. And we actually got this data from DPH and were assigned various restaurants that were flagged. The one that we're talking about now, because we don't just target the Thai restaurants, but we also have some mainstream restaurants we work with, like McDonald's. And McDonald's is set up in a certain way where we first got in touch with this particular branch that was receiving the COVID complaints. And we got in touch with the manager. And after we met the manager introduced us to a supervisor, and the supervisor actually oversees about 5 different branches of the McDonald's restaurant in the area. And what we did was first, we presented ourselves as a resource because we want to be able to let them know that we're here as a community resource for them. So of course, we definitely handed out PPEs. We were able to get a shipment of the N95 respirators because the employers are, they have to offer it to their workers. And so this is, one small way that we're able to help them. But what's really happening is we're trying to find a way to contact those workers that might not necessarily know about resources in the community or get assistance. And we want to be able to build that channel of communication without basically going on the premises thinking that we're trying to unionize their workers. So what we did was we started out with the employers, gained access to employees, and then we worked very closely with our Department of Public Health in LA County to bring vaccine clinics to various sites, not just restaurants, but also temples and other community areas, churches, and of course we have our regular farmers market clinic that Bart had mentioned. At McDonald's, after we made that formal kind of handshake with the supervisor, they were actually very welcoming about bringing the shots to one of their locations. They actually asked us for a different location, but space is very tight in some of these locations. So we had to consider that. And also, these vaccines have to be refrigerated. So we definitely need to consider a place for the lab partner to be able to pull up a van and have those vaccines accessible and potentially on so that they can maintain that refrigeration. So this particular patio area, it's actually covered. So it's one of the McDonald's locations where they had a nice big parking lot. So there was parking for the van and parking for people to come on site. And also, I said there was 5 different locations. So we actually had it from about 1 o'clock to 6 o'clock, and employees from the various locations were coming in all day. Even though we wouldn't turn away the public that would want a vaccine, we actually had the employees scheduled to come in for their boosters. That day we had about 40 vaccines, and about correct me if I'm wrong, Chancey, about 4 first-time vaccines too. And when they're there, this is a kind of a key opportunity to talk to them because of the 15-minute observation period. So we set it up so that they could come in, register with the nurses, get their vaccine, and we have an outreach table where we can kind of bombard them with all the information that we want to bombard them with while they're waiting for those 15 minutes. So we kind of have this setup going where this is also how we plan to conduct the survey that has been developed so that we can continue to talk to people for at least 15 minutes and make sure that all the questions in the survey are filled out. And then, so most McDonald's, I would say, have a separate eating area that is outside the restaurant. Many of them are covered. And so this is actually a great area that can be cordoned off by the management where you would kind of have control of that space. I would say to have a one-way flow is the best. We wanted it outside for the ventilation so that we don't have people going, inside and potentially exposing themselves when it's not necessary. I understand that, we're in California, so not all places are as friendly outside year round. But I think that many McDonald's or other kind of fast casual settings will have like a eatery area that's not in the restaurants. I would try to look for those kinds of venues. This clinic partner that we have here is actually a local community clinic called Clinica Romero. We've partnered with Fulgent Genetics. We've partnered with another clinic called Passport Services. We've partnered with the DPH, the Department of Public Health nurses directly. And, every clinic partner kind of has its pros and cons. But after working with the various partners, we've found out that the best for our community is really those clinics, those community clinics that know our demographics, they know our community, and they're willing to work with us.
So quick few questions. I'd say like the number one tip though for even getting access to the McDonald's is starting with the public health department, the local public health department, correct?
No. So the thing is, we kind of had a leg up because we have a program through the in partnership with the public health department to provide community resources to workers in the restaurant industry. So that's our specific target for the employers. But I think the key, even if you don't work with your public health department, is really to make sure that you have a lab partner. It would be great if it's the public health department because then, they would be able to send you data about where this is needed the most. But I really think that kind of starting off with that relationship with the employer, with the on-site manager, coming in with a friendly face, coming in with armfuls of resources to let them know that we're here for them because it's COVID. And we also know that it's hard for their workers to get transportation, to get a vaccine, to get time off, to get a vaccine. They don't want their workers taking time off to go get a vaccine, which is really what we're trying to get at here. We bring the vaccines to them and the workers don't have to take the time off.
And did you also were able to vaccinate customers, or is it just the employees, or did it vary?
On that day, we didn't advertise it to the general public. So it was really the employees.
Okay. So, well, thank you. We do have 7 minutes left. One thing also for people to consider too, when you think about a McDonald's or other restaurants, those are franchises, and franchises means you're owned by a local community member. And often in franchises, that local community member owns multiple locations. And so if you find that person, you can find it through the Chamber of Commerce. You can find, as Panita mentioned, the employer, the person that actually owns that franchise. Odds are they will probably know the other franchise owners or be a multi. I mean, most in smaller towns throughout California and throughout the United States, people own multiple franchises. If you find the 1 or 2 individuals, you're talking about 4 or 5 locations with a staff of 40 people because they're going to have multiple shifts. It can have an impact. Thank you for that amazing story. Thank you for everything you're doing. And thank you for teeing up the survey, which will be our final topic for today. So next slide, please. So the last step to unlock the funding from our funders is to know what our community is thinking and our efficacy. And so we don't need every partner to participate because we do need about 500 respondents for it to be statistically significant. And there are partners that obviously have windows. As Panita mentioned, they have 15 minutes after every shot. That's a great time to walk up with an iPhone and have a survey. So let's talk about the survey first. Next slide. The survey was developed by the steering committee, and we wanted it to be something that could be done in a few minutes or less, very few questions, something that you could do on site, something that you could text, something you could put on social media, something that you could send with a newsletter. A few organizations have already received the survey along with sample content to make it as easy as possible to post on social media, send a text or a newsletter. It is mobile responsive. You can fill it out on a laptop. You can fill it out on a phone. You can have your staff fill it out on the behalf of others or volunteers, whatever works best for you. Currently, it is now in 4 languages. We just finished it on Monday. And if you'd like an additional language, email help@mobilepathways.org and just send us the translations. We cannot translate it for you, but as we did for Panita and Chancey at Thai CDC, they just sent us the 6 questions, 6 or 7. There's a hidden question. Just send us the actual translations, and it is now available in 4 languages. The link to it is at the bottom. If Posey can put it into the chat. And then next slide, these are the organizations that we're hoping will walk with us to get to 500. You should have received an email already. In a couple of cases, like IMSchools, I know you did, Vendaya sent your first text yesterday. It may not be prudent to send this immediately. So you may not have received it. And I don't know if Indira at Up Valley also just recently sent their first text. We'll take this offline. We just wanted to announce it to this group. A few of you already received it and had questions, which we're happy to take at this point. In short, not everyone in the coalition needs to send out this survey. Not everyone can. It's going to be very hard. Sierra at Freedom for Immigrants works with our detained inmate population. We cannot text inmates. There's a lot of information we can't get about our detained immigrant population. There's no way we're going to be able to get this survey into ICE facilities. We understand that. And so hence with the Vaccine Coalition Steering Committee, we came up with these organizations, both because of their reach and also geographics. IMSchools and Vendaya, and again, we can open this up for questions at this point. We included you, so we aren't too California biased. So at that point, thank you for putting in all the questions, Posey. Any questions? I know Robert or Andrea, you guys got the email from Melody, who developed the survey and fine-tuned it with the steering committee. Any questions that we could answer about it?
Yeah.
I'm sorry.
Oh, sorry. Go ahead, Robert.
What languages are there? Yeah.
Currently English, Spanish, Thai, Aramaic. I'm not sure who requested Aramaic, but it's there. But again, and to be honest, and if you send us, do you need any additional languages outside of those?
Yeah. Can I add Tagalog there too? I
Yes.
can translate. Yeah.
Yeah, if you translate and just send it to help, I'll add it right away.
It literally, yeah. Posey's, she's Speedy Gonzalez, so she will get that in there in like half an hour or less. And by the way, for those of you that may have already started sending the survey, it's not going to impact any results. We can add languages as it's going out, so no concerns. Because some people, we've already started to get our first respondents. Andrea?
Yes, my question was, some of our team members were wondering if it was okay to put it on a paper, right? On a sheet, the survey. Sometimes when we're at bus stations or at metro stations, people are in a rush. And so it's really hard to get them to answer a survey as opposed to them having the conversation, walking with them and filling out the paper. So they were wondering if that would be something that's possible, or does it have to be directly through the link on the text?
I think the paper would work as long as, because there were similar occurrences during the Surf Coalition where people just simply could not get any access whatsoever, especially in very rural areas to even internet or phone signal. As long as somebody can sit down with, you know, the stack of 15 papers and input it in quickly. Because this is the survey here in that link collects everyone's responses. So we get a representative sample. So as long as somebody can do the intake into, you know, that link, that's fine.
Awesome.
There are
that
two,
work?
there are two questions
the
in
fun.
text. Sorry about that. There are two questions in text in chat. Can you see them?
Yes, so Vendaya's question, the goal, I think the first one was like roughly, this is a collective effort to get to 500 responses. We've done surveys before. If you text 500 people, you're not going to get 500 responses. People are busy, or text or send or do it in person. So roughly we're asking, you know, ideally every org, we're participating ourselves as well. We do have direct contacts ourselves. So I don't know our specific numbers, but I think we're going to try for 1,000 people to be able to get, you know, 100 responses. But really, if you do the math really quickly, we're asking about, you know, it might be 10 orgs. We'll see. We have 6 weeks. That's about 50 respondents per org. And depends. We don't know exactly. Like some people will fill it out right away. Sometimes you need incentives. So it's not a great answer, Vendaya, but essentially about 50 respondents, which means, you know, it would probably be for ImSchools to send it to everyone. And again, it's going to be really interesting data as well that we're going to get. And there was a second question. Do the survey respondents have to be family, clients, community owners who have attended a public health related event? It can be anyone. It isn't necessarily, the more broad this is, the better. The first question is, have you been vaccinated? Obviously, if Panita is doing it at a vaccination clinic when somebody just got their vaccine, they will answer yes. So it's meant to be a broad swath to see, are people getting vaccinated? And if not, do they feel safe? And so it can be anyone. We thought about that in mind to get as you know, the difficulty with surveys is you have to make them short, simple, and have an effective point. And the effective point of this one is, what is our community thinking about vaccines? Are they getting vaccinated? And if not, a couple of leading indicators as to why.
Mhm. And for those who have texting services with us, I'll be very happy to work with you to send out texts.
Yes, we can help with that. I realize we're at time. I should probably check in on the shot situation in ER. But thank you guys for everything you're doing. Literally, this entire parking lot is full. We had to circle the ER parking lot 2 or 3 times because there is not a car, like a spot available. That is due to the COVID surge that we're seeing in our area. Hopefully it's better in yours. But together we can overcome this. So thank you again for all your hard work.
Thank you.
Happy Thanksgiving, everyone. We'll see you next year. Too.